Emergency personnel of Reddit. What's the dumbest situation you've been dispatched to? Story 1 TLDR nursing home. Got called one night for an elderly woman at a nursing home with 2 broken ankles after an unwitnessed fall. We arrive expecting the usual nursing home mess that no one knows how happened. But no, our patient is just sitting there on the edge of her bed and smiling. So we got that going for us, which is nice. The patient is about as pleasant as anyone can be. At this point, the stereotypically unenthusiastic LPM materializes just long enough to hand me paperwork before vanishing into the ether. According to the papers, the patient has the usual history of diabetes, dementia, hypertension, kidney disease, most of your usual nursing home stuff. Based on my initial assessment, all of her vitals are stable, and she has no apparent distress. She's also a very sweet little old lady who still thinks that Nixon is president and quite eager to voice her disapproval of this unfortunate fact, but was otherwise happy to answer my questions. So I asked her, "Are your feet okay?" "Good as ever, I suppose." "Did you fall?" "Oh no, are you in any pain?" "No, why should I be?" "Do you have any idea why your nurse called us to take you to the hospital?" "Oh, now how in blazes would I know that?" "Good point." So I asked her if she can stand up, and she does. I asked her if she can walk, and she does. I asked her if anything hurts her anywhere, and she says no. Now fully realizing the struggle ahead, I sullenly grumble off to find the nurse again, while my partner sits with our patient. I find the nurse and inform her that the patient is in no distress and has no complaint at this time. I ask her if she'd like us to cancel the transport and disregard the call. Predictably, she tells me the patient's legs are obviously and severely rotated externally. That means she must have fallen, and the fact that I don't know that means, of course, that I am some type of idiot, so I ask her if she has any other information. She then spent the next several minutes supplying me with the usual line we lowly ambulance monkeys typically receive from nursing home staff. "This isn't my unit. She's not my patient. I've been on vacation. It was like that when I got here. I just started. I'm filling in for someone else. That patient's new," etc. Eventually, I walk back to the patient's room and get her. I help her into the first nearby wheelchair we can find, and off we go down the hall to the nurse's station, where we are met less than enthusiastically. "Can you tell me what's wrong again, just for my report? And also, so we can inform our patient what is currently transpiring. Are you an idiot? Her ankles are obviously broken. Can't you see her toes aren't even pointing the right way? Are you sure?" "Yes, look at it. Actually, look, both ankles are completely backwards. Okay. But do you want to have one more look for yourself, just to be sure that they're really broken and that she doesn't just have her shoes on the wrong feet?" Story 2 dispatched to a child with seizures, who had a history of epilepsy. Got on scene, and the kid was coming out of seizure and was postictal. Packaged the kid up to transport to the hospital, and his mother is screaming at me that he must have his peanut butter. Not sure what she meant. I asked her what she was referring to. "His peanut butter. He has to have them. I have them in a jar here. Take these peanut butter to the hospital." She handed me a small pill container. I look at the label and read that it is phenobarbital, a common anti-seizure medication. I asked the mom if this is what she meant by peanut butter. Apparently, she never read the pill bottle label and misheard the doctor pronouncing phenobarbital as peanut butter. I realize this is the second post in one day where I have referred to peanut butter. Story 3 got called for a child who her grandfather and legal guardian was actively abusing her. Notes said screaming and crying was heard in the background, as well as "don't hit me again," and "he's trying to kill me" turns, or a 12-year-old girl had snuck to go see her 20-year-old boyfriend and came back drunk and stoned reeking of weed, and where her grandfather tried to punish her by taking her phone and grounding her, she grabbed a knife and tried to stab him. In the process of disarming her, he pushed her backwards and into a table, knocking a lamp over. It was at that point she grabbed a phone and barricaded herself in a room and called 911. Story 4 I got called for a woman experiencing stomach pain, which she calmly claimed was a 1010. Must have been quite the trooper since her husband drove her 30 minutes across the county past the hospital and 2 urgent care centers to let her mom look at it before calling the wee-woo. For someone who had been having unprotected for 7 months, she sure was confident she wasn't pregnant. The nurse who had to explain to her the way these things work was right on the corner of amused and pissed. Story 5 I'm not the emergency personnel in this situation, but I called 911 because I found my neighbor, an elderly lady, lying on the ground outside. She was slurring, unable to get up, and generally dizzy looking. I thought she had a stroke. They got there and were talking to her for a few minutes before telling me that she was just drunk. Story 6 lady with Alzheimer's called 911 for a spider at her kitchen, but described it as someone in her kitchen. As if that isn't silly enough, the spider didn't even end up being a spider. It was a dead fly on her windowsill. Story 7 paramedic here, dispatched to a man with a groin injury. Arriving on scene, I found a 30-year-old man doubled over in pain and bleeding quite heavily from his crotch area. Long story short, He wanted to see what happened if he put peanut butter on the tip of his penis and let his Rottweiler lick it off. I think he was partaking in some sort of masturbatory thing and wanted the dog to give him a form of oral. I controlled the bleeding the best I could and got us to the hospital. He underwent microsurgery to try to save his mangle, but I understand that it was unsuccessful. Also, the part of his penis that was eaten by his peanut butter-loving dog was resting comfortably in his dog's digestive tract. Dog swallowed a good chunk of his penis. Can't make this stuff up. Not sure if it was chunky or smooth peanut butter, which was the first question my chief asked me upon returning to headquarters. Story 8 briefly shadowed a small-town fire department. Lady called in that some dude was impaled by a branch while pruning trees. Rushed over there. It was all makeup. They were shooting a film. All the neighbors had been notified, but she forgot apparently. Story 9, during one of my 24-hour ambulance shifts for EMT basic training, we got a call to a Big Lots for a laceration on a finger. It was essentially a paper cut from a rough edge of a chip candle. I got to practice my EMT skills by applying direct pressure to a non-bleeding index finger. Even got to put a Band-Aid on it. The girl was acting like she could not look at her finger and was going to pass out from all the blood. The gauze strip I held on her finger didn't even have a spot. Don't worry, she sued. Seriously, she did. Story 10, dumb but tragic situation, courtesy my EMT best friend. Take it away. Tay things learned from a patient with CC a spider bite on my one. If normal play just isn't doing it for you anymore, the obvious solution to this problem is to order a fancy, exotic tarantula from a fancy, exotic tarantula seller, and then proceed to somehow coax and or shove said arachnid into your rectum. A more accurate CC would have been spider bite in my two. Spiders become very upset when this happens, and they will bite you multiple times before expiring. Lost somewhere in your lower bowel. No, EMS will not look for it for you. The pay grade isn't nearly high enough. Some things are best left to physicians. 3. While it is helpful to know the exact species of said spider you've shoved up your, because YOLO, this information is not very useful when you've waited 3 days after being bitten to call the boo-boo bus. For, yes, that discharge is not normal. Yes, it is probably related to being bitten by the spider. Geez, no. Will not go away on its own. No, there's not something you can put on it. But thanks for noticing the for external use only instructions on the bug bite cream. Guy ended up losing everything up to the transverse colon. Not sure exactly what he was going for. Sadly, all of this might have been a little easier to understand if he had irradiated the spider first. Poop in a Bag Man is not nearly as catchy as Spider-Man. Story 11 paged at 3 a.m. for an ill person. So I'm already tired and being sent to something vague isn't what I want. Arrive on scene and walk to the front door. Middle-aged guy opens the door and looks absolutely terrified. He rushes us in, and we ask what's going on. He replies, I have the hiccups. Partner and I are exhausted from a rough 24-hour shift, and we are incredibly confused. We ask him to clarify, and he explains that in his 40-odd years of life, he's never had a case of the hiccups, and is absolutely positive his life is in danger. We do our assessment, and then explain that it's normal and really doesn't require the ER, much less us. He demands that we take him to the ER. So we oblige. When I called in the report, the hospital asked me to repeat the chief complaint 3 times. We were kicked to triage the second we walked in by some very annoyed nurses. Luckily, they understand that we cannot refuse transport if the patient has a complaint and wants to go. Dude was absolutely fine. Story 12, 20-something-year-old guy called 911. He bought new shoes a few days before. They were too tight. His feet hurt. He was still wearing them when we got there, but I successfully extricated him. Story 13, my husband was a cop. He got called out to an active domestic one night about 2 in the morning. Gets on scene. Guy comes out and says his girlfriend assaulted him with a weapon. Turns out she threw a hot pocket at him. Story 14, firefighter and 911 dispatcher here. Once as a dispatcher, took a call for suspicious activity. What was suspicious? There was a bicycle in the front yard of our neighbor's home. She told me, I've never seen a bike there before, and it just seems weird. We didn't even bother to dispatch that one. As a firefighter, once during a huge rainstorm, we were dispatched for a vehicle in the water. This intelligent gentleman has decided to try to ford a river that was several foot high in his small Toyota car. With his girlfriend in the vehicle, he drove into the water and predictable got stuck. He immediately jumped out and swam to shore, leaving her standing in the trunk with the vehicle stuck at an angle upward in the water. As we got his girlfriend out, he tried to pass it off as her fault. She slapped him, and none of us said a word about it. Another time we were called to a police assist. When we arrived on scene, the officer directs us to the guy in the back of his cruiser. The guy shows us his finger and says it hurts. The finger is covered in a paper towel held on the finger by a rubber band. When he removes the rubber band, we see that the top 2/3 of his finger has been amputated and has been unattached for a couple days. He had just been walking around with his amputated finger held onto his finger stump for a couple days and just decided when he was being arrested that that was the time to deal with it. Story 15, my sister was a dispatcher, and she would tell me all sorts of dumb calls she got. They'll tell you guys one of my favorite stories she told me. One time my sister got a call from a woman reporting that a man robbed her during a heroin deal. Apparently her dealer ran off with the money and gave her some random substance that doesn't get you high, but it looks like heroin. The woman was being serious and acting like she was getting unfair treatment from a legitimate legal business. The woman is a sheltered middle-class woman from the suburbs. She was genuinely surprised that anyone would have the audacity to act that way in that kind of situation. She wanted that man arrested and wished to sue him. According to my sister, she had the I demand to speak to the manager attitude over the phone the whole time. Story 16, a mother called 911 because her son spilled a bottle of Tide soap and was walking in it. She even called poison control before she called 911, and poison control told her there would be no side effects. The only advantage was the whole house smelled like lavender. Story 17, kid got his head stuck in a fence. Then he got stung by a bee. Everyone present that day, including the kid, found out he was allergic to bee stings, so then they had to resuscitate him. Good times, edit spelling. Story 18, guy moved out into the country. His 1 to 2 acre lot was surrounded on 3 sides by farm fields. Come harvest time, he calls 911 and blocks the farmers' access to their field with his vehicle. Want me to force the farmers to stop harvesting because when he leaves all of his windows open, the inside of his house becomes dusty. Story 19, got dispatched to a nursing home for a guy who was pulseless. Arrive on scene to find the nursing home staff doing CPR on a guy who had been dead for at least 6 hours before they found him. They couldn't understand why we called it after hooking him up to our monitor and finding he was asystole, then didn't understand why we weren't going to transport him to the hospital. Story 20, dispatched for a very strange gas-like smell in the backyard. We got there and walked around with our sensors. All levels were normal. Well, miss, everything is normal. What's that smell then? She asks. All we smell is some mulch. She exclaims, is that what that smell is? They just had mulch put in behind us yesterday. How long is that smell going to be around? Are we going to have to keep our windows closed for that long? I'm sure I could come up with many more, but that one sticks out. Story 21, not quite in the same vein, but I worked at a vet clinic that received a report from the local overnight emergency vet for a dog the owners thought was having a seizure in the middle of the night. The dog was diagnosed with dreaming. Story 22, not a paramedic, but work in healthcare, and they train us in emergency care at university. Guy told us on a training day that they were dispatched to a house after a woman called in hysterics, claiming her baby had been raped. Turned out her pet dog was mating with a neighbor's dog in the back garden, and she got upset when she saw it. Story 23, my dad is a volunteer fire captain. I was at his house, and he got a call for a guy that flew a powered paraglider like a go-kart with a big fan, pushing it whilst being suspended by a parachute into a tree. I went on the call with him, and the guy was stuck in the top of a tree with a broken ankle. It took hours to extricate him. For bonus points, the tree was in the yard of a trailer house with some very hillbilly people, so there was a constant circus of guys in wife beaters and women in muumuus yelling at each other. Story 24, not your typical emergency personnel, but I work for a commuter railroad, and I get called out to inspect the equipment when there are pedestrian vehicle strikes. There was a couple making out on the tracks and saw the train coming and decided to play chicken to see who would bail first. The girl lost, both the game and a leg. Story 25, my ride along during EMT school. Had to have a certain number of hours spent working with a rescue squad. On a slow night, our third call was of a shooting that, at the time, had the victim in critical condition. We responded and couldn't find out. The victim put on a bulletproof vest and told his GF to shoot him. Well, she did, and missed the vest completely. Poor guy died later at the hospital. No alcohol involved either. Story 26, a man on PCP who broke into an apartment, stole a pair of women's panties, changed into them, was discovered and chased away by the woman's boyfriend, and we found him running around a neighboring abandoned lot wearing nothing but said panties. Story 27, dispatched to illness for a 90-some-odd-year-old woman. She stated that she had eaten 2 bites off leftovers and then realized they were leftovers and wanted us to induce vomiting. We are a BLS unit. We don't do that, which we explained, and her pissed-off daughter freaks out and is yelling at the mother about how she made the EMTs come all the way out here. And now she's going to go with us to the hospital to get her stomach pumped to the hospital. We stop her right there. ADN explained that the hospital isn't going to perform a painful and unnecessary procedure over eating leftovers. It ended up being a refusal, and we didn't take her to the hospital. Also in my city, units were dispatched to reports of a body in a dumpster in the wee hours of the morning. Upon arrival, they discovered that the body was actually a Justin Bieber standee. Story 28 sent to a lady whose 2-year-old kid had licked a baby wipe, like touched it to his tongue. Then he made a face and went on with his 2-year-old's day. Best part was that mom was a nurse and thought it might have burned his lungs. Ridiculous at its spelling. Story 29, my very first call on my very first post as a new EMT. It was a small rural town fire service about 50 miles outside of a city. It had been a slow day, slow evening, slow night. Not a thing happened about 4 a.m. Tones drop. I'm deep asleep, but I fly out of the bunk, put on my boots, and race downstairs and hop in the back of the ambulance. I was new and still waiting to be cleared. So I was the third in the truck. They light it up and haul out of the bay. About 10 seconds later, they pull over into the parking lot of a convenience store. There are 2 cops. Their lights are flashing everywhere, and the fire truck pulls in behind us. Fire always went along on calls. Mind you, I have been awake only like 2 minutes at this point. The lights, the noise, it being dark, all of that was incredibly disorienting. The medic on the rig was a surly, no-nonsense woman that didn't really suffer fools at all. She approached the cops, and they pointed to a small man that was just standing there. She approached him and asked him what was up. He started to talk to her, and she interrupted him and said, "Are you high?" "Yes, ma'am." "What did you take, meth?" "What's the problem?" "I is about to fall off." "You're what now?" He whispered very loudly, "My is falling off." Why is it about to fall off?" "I shot up down there." "You did what now?" "I injected myself down there." Why, I wanted to see what it was like at this point. I'm looking around like I had stepped through the looking glass. WTF is happening here? The cops were doing everything they could not to bust out laughing. Then she said, "So you think your penis is about to fall off?" Then she lit up his crotch with a flashlight. He was wearing jeans, and there wasn't any blood. As soon as she did that, he started unbuckling his belt. "Here, look up." "No, don't even, just get in the back." "No, not on the cot. Sit on the bench, Ned. Get his vitals. I can't lay down on the cot." "Nope, the hospital is less than a mile from here. They will take care of you. I got the vitals," and we drop him off. He was tripping, but was very polite and respectful. It was really an odd experience. We found out later that he was a schizophrenic that was off his meds with a really abusive girlfriend that talked him into stuff like that. I guess for me, it's less about the dumb stuff and more about how often you find yourself in supremely surreal situations. You could spend 30 minutes working on a code with no luck, and a tearful family is crying, hugging you, and thanking you. Thanking you for not being able to save their loved one. WTF? Or a little old lady that's lonely and calls every night with difficulty breathing, just so someone will stop by. This is a true story. They had a nightly dollar squares on when she would call. Or an elderly World War II vet that walks up to the station with a bag of groceries for the department, then says he's been having chest pains and wants you to look at him, and that he decided to make an excuse to walk up here, rather than risking upsetting his sick wife and bothering us over nonsense. Some of it's funny, but I'll be honest, when you break it down, it's usually pretty heartbreaking. You just kind of look for the humor where you can find it to cope with always seeing people in what is often one of the worst moments of their life. Cop here got dispatched to a woman in labor at 3 a.m., arriving on scene, and realized I had been there before with social services before, because the neighbors had smelled the apartment through the walls because of all the buildup of garbage. Got into the place, and the lady is running around with nothing but a Motley Crue t-shirt on, and she's screaming that the baby is coming out. Bear in mind this gal looks like a Yeti, and it smells like one took a dump in the middle of the apartment. I knew right then that I wasn't going to get down there and play catcher. My germaphobe partner is standing with his hands as close to himself as possible, trying not to touch anything, and says, "Wait, I got this. How far apart are your contractions?" She says, "About 3 minutes." I ask him, "What does that mean?" He says with a blank look on his face, "I don't know, I saw it on TV." It was about minus 30 F out that morning. So I tell Labor Yeti that she should probably put some pants on because the ambulance is on its way. She grabs a pair of vintage Zubas out of the closet next to the door and puts them bad boys on. I go upstairs to get her 4-year-old daughter ready to go to the hospital as the ambulance members arrive. They head out the door with Labor Yeti, and all of a sudden I hear that they're en route to the hospital with mom and baby. I get to the hospital and ask one of the EMTs what happened as he's hosing out the ambulance, and he said that she lifted up a leg to step into the ambulance. She stops and says something fell out, and all of a sudden they hear her crying. They rushed her into the ambulance and cut the baby out of the Zubas and got her to the hospital. And bam, the story of Sweatpants Baby was created. Story 3911 call for a 4-year-old who had a nightmare. Edit parents called specifically for a nightmare. And that was how the dispatch went out. Not trouble breathing, not possible seizure, etc. Thought of some other's unconscious child. Arrive on scene to find a kid laying down on the floor in a store. No history. Full day of school, was running around the store being a brat when he was reprimanded. Promptly fell out. Definitely responsive to pain. Pupils are good. So I loudly announced we're going to have to stick him with needles and draw some blood. Give him fluids. Patient regained consciousness and try to run away. Unconscious diabetic. Get on scene, and there's a woman laying on the couch with sugar sprinkled on her. The woman's son knew it was a problem with low sugar and figured he'd try to help. It would have been super cute, except the kid was 16. Please, everyone, educate those around you if you have chronic health problems that can become emergencies. One patient that wasn't mine, but came in on another unit while we were waiting for triage. 17-year-old male, couldn't get it up with his girlfriend, insisted that nothing like that could ever happen, so something must be wrong. They call 911, get transported, make it to triage, and get promptly sent out to the lobby. The nurse, as they're walking away, says to us, someone needs to show that girl how to use her mouth. Story 31. Last 4th of July, a lady got drunk and shot a bottle rocket out of her vagina. Let's just say the hole must have been too deep. BC, it exploded without launching and did a number on her coocher. Story 32. So I worked for an EMS crew at a major university. There's one event that happens every spring where the undergrads get absolutely shithoused. I've never consumed more alcohol in a 24-hour period than as a student during one of these spring flings. We got dispatched for a naked drunk kid, which wasn't dumb by itself. No, what was dumb was that by the time we arrived, the kid had run off. Then we head back to base, and every 20 minutes or so, we get that call for the same kid in a different location. This goes on for a few hours, and if you plot the locations we were called to, you could see him inching towards campus. We finally found him passed out in the freshman dorms. You made it home. Hooray. Story 33. My dad is a firefighter. He is a regular who calls 911 because they get stuck on the toilet. No, it didn't fall in or get their intestines ripped out by flushing. They are so large that they lose feeling in their legs that they cannot get off of the toilet. He knows the guy by name now, and my dad says he's a pretty nice guy. He just needs to not sit on the toilet for so long. Story 34. Several years ago, when I was a paramedic for a volunteer fire department, we were dispatched for a possible heart attack. Arriving upon the scene, we grabbed all of our equipment and started to run towards the house. We were stopped by the house's owner, who was screaming, "She dead, she no move," and pointed toward his car. He had called 911 because his car's battery was dead. Story 35. Responded to a medical alarm, i.e. life alert activation, with the patient not responding to the dispatcher's questions. Turns out it was an old lady who wanted someone to fix her TV. You're right, we fixed it. Story 36. Me. A police officer in London responding to a call from a German tourist that there was a very large poisonous spider in the street. On arrival on scene, I see a very large German male attempting to divert pedestrians away from the scene to prevent the spider from attacking them. I bent down to examine the spider, hearing our German tourist exclaim, "He is so brave." I picked up the large plastic toy spider in my hand and walked over to show our hero that it was actually a toy. He screams, faints, and hits his head on the pavement. I pull out my notebook and regretting my mother's advice that I should have been a lawyer. Story 37. Not EMT, but work in emergency. Lots of stories, but one woman was waiting in the waiting room for a couple of hours after self-presenting. She started getting shitty with the wait, so went outside onto the street and called an ambulance. They came and brought her back inside, but through the ambulance bay, and wanted to be triaged again. Her initial triage was logged as did not wait, and the re-triage with a new time, but the same category, and then sent out to the waiting room. Her thinking was that if she came in by ambulance, then she would get a bed straight away. Nope, she just had been put to the bottom of the list again. Story 38. Got a 911 call for an elderly man, PNB pulseless, not breathing from his adult daughter. Caller stated that they had been having a barbecue at Grandpa's house when Grandpa said he was tired and went inside. Granddaughter found Grandpa unresponsive in his recliner and ran outside screaming. 911 is attempting to coach the daughter through CPR, but she's having none of it. Ambulance rolls out with lights and sirens. Engine rolls out behind, and halfway to the scene we get the call to cancel. Apparently Grandpa was having a nap. Not dead, just a nap. Story 39. Not emergency personnel, but someone called 911 on us because their prescription wasn't ready, and it wasn't even for a drug that was immediately life-threatening. Story 40. Working security for Six Flags in my college days. We get a call one day about a possible body in a car. Security dispatch to 550. Go ahead reports coming in of a vehicle in Section Lima with a possible deceased person. Brain says just got real 550 dispatch. Show me responding code, 3 lights and sirens coming in. I see a group of people standing by a car waving me down. My heart is about to jump out of my chest. The adrenaline is pumping. I got no clue what I'm about to see. Slam the transmission and park and jump out of the vehicle and began shouting to clear a path. The crowd parts like I was Moses parting the sea, and I see the car. It's an old-style ambulance, or hearse. My memory is a little fuzzy, but it was like they had on Ghostbusters, but you can see through the windows that there's a body under a sheet on a stretcher in the back of the vehicle. At this point, both anger floods over me. but I'm also relieved I didn't just find a murder scene. Anger takes over, and I start to think this was some sort of body transport crew that was in the middle of work and decided to go ride roller coasters for the day. Are you freaking serious? Who does that? Radio is calling for an update, and I'm doing my best to relay what I'm seeing. We didn't cover this in training. I'm not sure where to go from here, so I just try the door handles and find one unlocked. The crowd has closed back and around me as I lean in and hesitate as I grab the sheet over the body and pull it back to discover a mannequin. Throw the sheet down and start cussing all the stupidity that has occurred to bring me to this point in time. Story 41 in from Australia, and once I saw in the local news that his guy heard noises in his kitchen and believed it was an intruder, what actually happened was a giant mud crab had crawled up from the river and was rummaging through his cabinets. They interviewed the policeman who went over, and they were literally joking and making fun of the guy on the news. Story 42, for all of you responders, thank you. Some of you I have no idea, as I could not see at the time, responded to my airway obstruction recently and transported me. I felt like a celebrity when I walked out of the ER completely fine after, and the nurses at the front desk were so happy to see the airway obstruction all better and walking out the door. You guys are heroes. My daughter had to call for me, and I was transported without shoes. They couldn't clear me at home, so we ran lights and sirens to the ER, and I had to hold my head and neck in a certain position to get air and could not see anyone. Thank you for saving my life. Story 43, well, last year we had someone who had noticed water coming out of his toilet one evening and decided that the best course of action was to have us volunteer fire department come out. Now, we're happy to help when there's actual flooding. I've pumped out my share of basements in the last few years. In this case, we're talking about a backed-up toilet and maybe half an inch of water in one room, though. The guy calls emergency services, who try to explain to him that this is a job for a plumber, not the fire department. He insists, so we get called. 15 people get called away from their family asleep, whatever, suit up, fill 2 trucks, and drive over there. One of us gets out, talks to the guy, takes a quick look at the bathroom, informs him that he should call a plumber, gets back in the truck, and home we go. Not quite sure what the town charges for our time right now, but I'd have loved to see that guy's face when he got the bill. It's a toss-up between that and this story I've posted before, still the most absurd thing that's happened in 10 years of being a volunteer firefighter a few years ago. At about 8 a.m. on a weekday morning, I'm just getting ready to leave for university when my alarm goes off. I run the 100M to the station, grab my uniform, and try to find out what has happened. Apparently someone had called in because his bedroom was on fire. All right, we drive there, and from the smoke coming out of the windows, it's pretty obvious that this wasn't a prank call. We had a couple of those at the time, so we didn't necessarily expect an actual fire until we saw it. The front door of the house is open, but the guy who called the fire in is nowhere in sight. Well, we're not going to wait around while the house is on fire. Me and another guy grab our gear and go into the house, wearing full SCBA. The fire is upstairs, still noon in sight. We reach the bedroom, and luckily only the bed is on fire. We douse the mattress, then drag it out to the balcony and throw it down in the yard. Then make sure that there are no embers anywhere, etc. We're just leaving the room when we're greeted by a man wearing nothing but a towel, asking if we're finished because he has to get his clothes and get ready for work. Apparently, this guy was the owner of the house. He had woken up early and gone for a morning jog. While his wife had made breakfast, he returns. They eat together. She leaves. He goes upstairs to shower and get dressed for work. As it turns out, his wife smokes in bed and had been somewhat careless with her morning cigarette. Now, when he sees the smoke coming out from the bedroom, he does the rational thing and calls the fire department. Then, however, instead of going outside, he gets into the shower, shaves, etc. So he won't be late for work, ignores the sirens, and us calling for him. Figures would be able to find the fire ourselves. As it turned out, all his efforts were for nothing, and he was going to be late for work after all. The EMTs decided to take him to the hospital because it turns out inhaling smoke is bad for you. TLDR guy with smoking hot wife needs a cold shower. Let's firefighters take care of the bedroom stuff. Bonus story, one evening, we had been called out to a car accident. Driver didn't notice a roundabout and jumped over it, flipped his car, and got back to the station at about 11 p.m. We decided to have a quick beer before going home, which turned into 2 or 3 beers, so we were just getting ready to leave at about 1 a.m. when the alarm goes off again. Turns out a truck went too fast through a construction zone and was now laying on its side. We get there close to the road, make sure the driver is okay, etc. It quickly becomes clear that we're not going to be able to put the truck on its wheels by ourselves, so 2 large cranes are called. We're informed that that's going to take a few hours, but we need to unload the trailer anyway, since it's going to be too heavy otherwise. It was an open-top trailer, filled with about 25 tons of turnips. A third or so had already spilled out, but the only way to unload the rest was by hand. Shovels proved to be useless, so we spent the next 2 hours sitting on a shrinking pile of turnips. throwing them out one by one. Eventually got home at about 8 a.m. and called out of work due to turnip-related fatigue.